لا
ايوه
كبير
ايوه
يا مستر.
Yes, welcome back. طيب okay. An 18-year-old high school football player was kicked in his left flank. واد شاب عمره 18 سنة مش كده؟ This is a years 18-year-old high school معناها he's football player يعني he's a professional kicked in his left flank. 3 hours later he developed hematuria. His vital signs were stable. لاحظ دي كلها keywords. The initial diagnostic test in the emergency room should include which of the following. يبقى ده patient لاعب كورة وضربوه في الفلان left flank. حتة وين؟ What organ expected to be injured in the left flank? Especially he developed hematuria. Kidney. His vital signs were stable, so he has no ongoing bleeding. مش كده؟ لازم تشوفوا الكلام ده. He has no obvious ongoing bleeding. The initial diagnostic test in the emergency room should conclude which of the following. Patient kicked in his flank, left flank. What type of trauma is this? What type of trauma?
Blunt trauma.
Blunt trauma to the abdomen actually. Left flank is part of the abdomen. يبقى what is the best? What we do? What is the initial diagnostic test in a stable, vitally stable patient with a trauma to the flank or a trauma to his abdomen? Blunt trauma to the abdomen.
IV urography.
Diagnostic peritoneal lavage.
The diagnostic peritoneal lavage because this is a blunt left is a blunt abdominal trauma. As you know, blunt abdominal trauma, you start with with diagnostic peritoneal lavage to exclude انه في اي هيماتوما مش كده؟ في ناس يقول لك intravenous urography. What is the importance? What is the importance of intravenous urography? Yes?
Renal injury.
Renal injury. It will show if the kidney is shattered. طيب. What is the problem of doing intravenous urography? عايز تعمل شنو؟ X-rays مش كده؟ عايز to give intravenous fluid من intravenous urography مش كده؟ And maybe you have and then you will have the serial follow-up and this will may delay the patient if the patient have intraperitoneal bleeding. Okay? Intravenous urography can be done, but first you have to exclude any ongoing bleeding intraperitoneal. You get it? You get why we choose diagnostic peritoneal lavage? بينما انه most of you they think انه you have to choose intravenous urography. IVU. Okay.
بروف لو كان في الخيارات في سي تي كان حنختاره؟
Yes طبعا. Yeah عشان كده اخترتها. And the best option is to give to do a CT. لكن he didn't put it because he wants you to choose between intravenous urography and diagnostic peritoneal lavage. And as I have said, diagnostic peritoneal lavage is the best method of diagnosing bleeding in blunt abdominal trauma. If there is CT, then you will choose CT definitely. You agree on that? But if there is no CT, you will choose diagnostic peritoneal lavage. Okay? DBI, DBL. Okay? Okay, next. Thank you. And if he omit diagnostic peritoneal lavage, you can choose لو كان خط أي حاجة تانية غير diagnostic peritoneal lavage, you can use intravenous urography. Okay? But because he put diagnostic peritoneal lavage is very important to exclude any intraperitoneal hemorrhage if you don't have CT. A 63-year-old man presented with progressive dysphagia and 20 pounds weight loss. Barium swallow revealed a mid-esophageal lesion. Diagnosis is best established by what? بدون ما تشوفوا عيان عمره 63 سنة عنده progressive dysphagia. Yes.
endoscopy.
عنده progressive dysphagia. عنده progressive dysphagia. Yeah. Endoscopy and biopsy. I agree with Bahab. Yes, لأنه because this will give you a clue. It will show you that the occlusion الظاهر في نص الميدل اسوفاجس ده شنو؟ وتشيل منه بايوبسي والبايوبسي تقول لك this squamous cell carcinoma or adenocarcinoma. And this is the best to establish the diagnosis. Okay؟ لأنه السؤال محدد. Diagnosis is best established كيف؟ خلاص we are sure this is a squamous cell carcinoma of the esophagus when we took a biopsy and came as a squamous cell carcinoma. Okay. Next. upper gastrointestinal endoscopy and في question افتكر مست ولا حاجه كده نرجع ورا ثاني. في سلايد افتكر مست. اول واحده ارجع ورا لسه باك.
يا مستر معلش في الابدومينال تروما مش في حاجه اسمها فوكال اسسمنت والالتراساوند ده بيتعمل 200 فاست ده.
Yes بيتعمل في تروما. Yes you are right لكن he didn't mention it. Is it mentioned in this question? Yeah.
يعني بيجي في الترتيب 200 at the moment of the patient admission at the ER ولا؟
Yes في ال ER. usually الفاست بيتعمل في ال ER. Yeah. أحمد في ال ER I'm going to give a question.
ايوه يا مستر معاك.
Yes ده.
دي السلايد دي اللي كانت محذوفه.
ايوه ده قبل ما شفناهوش.
اوكي.
في كم سؤال ما شفناهم قبل. The most common fluid disorder of surgical patient is what is the most common fluid disorder؟ ده سؤال أسئلة very easy. What is the most common fluid disorder؟ fluid disorder لاحظ السؤال ده إجابته واحدة بس ما داري لا داري أقول. لأنه hyperkalemia is not fluid, hyponatremia metabolic acidosis is not fluid, metabolic alkalosis is not fluid. يبقى ده one single right question مش كده؟ وزمان الأسئلة دي بدت كده إنه إجابة واحدة الصحيحة لكن حسي بقت كلها صحيحة. إيه بالسؤال ده إنه الإجابة الوحيدة الصحيحة هي شنو؟ extracellular volume difference. أيوه لأنه الوحيد الفلويد ما في فلويد ثاني في الكلام ده. أوكي فده البداية القديمة للأسئلة لكن حسي كلها راحت. إيه شوف السؤال اللي بعده إحنا جاوبناه. next to it أيوه دي جاوبناه مش كده؟ اللي هي قلنا لازم نصلحها قلنا 24 hours. ده كله جاوبناه. Any questions so far؟ Okay. يبقى نرجع تاني in conclusion to answer the best answer one best answer the best رجعنا للسلايد الأولى قبل الأسئلة. the best is الثانية the best answer قبل الأسئلة طوالي. the best answer is user choose according to the common, the serious, the important, the suitable, etc. Okay. The last slide is Professor Rashid examining a candidate. Actually, Professor Rashid is the Chancellor of the Sudanese Medical Specialization Board. His answer is carefully and with a lot of concentration is examining this student. Okay. You see?
دكتور ممكن السؤال بتاع البلانت abdominal trauma؟
Yes أحمد جيب لنا السؤال بتاع البلانت abdominal لو سمحت أحمد. لا اللي قبله. Yes.
أيوة ده.
Yeah.
طيب يا دكتور الفيتال ساين وارستيبل دي ما بتستبعد البليدنج الابدومينال ولا peritoneal bleeding؟
No, the bleeding is not major. As you know, if the vital sign to be disturbed, as how much to lose, how much blood to lose, more than 1 liter. مش كده؟ You get it?
Okay.
Yeah. Okay. سؤال ثاني شنو؟ atelectasis. Yes. Go back to the بتاع laparoscopy. Okay. قلنا السؤال question بتاع laparoscopy it is 24 hours following laparoscopy. So this makes 24 hours following laparoscopic cholecystectomy, because if it is open like this, all the possibilities are right. Okay? ممكن يكون 5 days following laparoscopic cholecystectomy يكون infection is true. Okay? فسو احنا صلحناه وقلنا 50-year-old male developed fever and rigors 24 hours following laparoscopic cholecystectomy. And this will make the likely cause is atelectasis. Okay? Azura sir.
Okay, thank you.
Thank you.
يا دكتور 5 days
Any
wound
question?
infection وأقل من 5
Yes,
days
5
cholangitis.
No, cholangitis, it needs, yes, cholangitis may occur after 2 days or so. لكن it's not immediately to 24 hours. Okay?
اوكي
لأن لازم يحصل شنو عشان يحصل cholangitis يحصل شنو؟ يحصل stagnation، يحصل stagnant، يحصل the bile is not flowing مش كده؟ obstruction. وتاني يحصل overgrowth of the bacteria inside the bile. And this all will need time. You get it? It's not 24 hours.
اي
دي اللي بيسموها post cholecystectomy syndrome.
No, post-cholecystectomy syndrome, that all teaching that usually the gallbladder is not the cause of the symptoms. Now they think of, they are talk about stump cholecystitis, stump appendicitis, or residual gallbladder, or a patient يكون عنده peptic ulcer overlooked, مش كده? And this is what we call,
Yes.
all days they don't know how to diagnose this what is going on. So they called it post-cholecystectomy syndrome. This is an old fashioned syndrome. But nowadays, most of the people, they know that the problem was not in the gallbladder. The patient may have peptic ulcer, may have reflux esophagitis, may have other problems rather than cholecystitis. Okay? As you know, in a percentage of patients, the gallstones will be an incidental finding. مش كده؟ So some patients will have some symptoms related to the peptic ulcer, duodenal ulcer, or whatsoever, and the ultrasound done and show gallbladder, and the gallbladder is removed, and the patient continue to have the symptoms. And this because the problem was not from the start the gallbladder, it was the duodenal ulcer, or reflux esophagitis, or gastritis, or whatsoever. Okay?
Okay, Mr.
Thank you. Okay, next session, I think we'll talk about the OSCE. Actually, we are going to talk about the OSCE, most likely for